Hi, this is Dr. Al-Kufi. I'm one of the interventional cardiologists in Johns Hopkins Aramco Hospital. It gives me a great pleasure to talk to you in the World Heart Day. I'm going to talk about facts about hypertension. And you might be wondering why I chose hypertension. The main reason it is the #1 risk for global death. Around 10 million people die each year because of hypertension or as a consequences of end organ damages related to hypertension. And unfortunately, only half of the people with high blood pressure are aware of their problem. High blood pressure usually has no symptoms, so you may not know you have it. Often treatable, and the simplest way of knowing whether or not you have this problem is just to get tested. How? The test is very easy, and you could do it even in your home using an automated blood pressure machine or through the clinic by a healthcare provider. What is the blood pressure? Usually, the blood pressure is the force exerted by the blood as it leaves the heart on the wall of the big arteries that supply the whole body. There are two measurements. One, commonly known as a systolic blood pressure, which is the blood pressure recorded during the heart contraction, and there is a diastolic blood pressure, which is usually recorded when the heart relaxed. And usually we refer to those measurements using millimeter of mercury. The blood pressure is the pressure of the blood pushing against the walls of your arteries. Those arteries are tasked with the job of carrying the blood from your heart to other parts of your body. Usually the blood pressure normally rises and falls throughout the day. You can manage your blood pressure to lower your risk for serious health problems that may affect your heart, brain, kidneys, and eyes. Blood pressure, as I indicated before, has two measurements. Make sure at some point to have your blood pressure checked, either at home or by a healthcare professional, and know your number. How do you measure the blood pressure? It is very important to know some facts about measuring the blood pressure. We usually like to measure it with the patient relaxed, and this can also be done at home, usually sitting down. After 5 minutes, we try to ask our patient to avoid taking caffeine or nicotine or exercising within 30 minutes of the blood pressure readings. Try to sit down and think about beautiful things. You have to choose the right blood pressure cuff that fit the size of your arm. The blood pressure cuff has to be at the same level of your heart as shown in this picture. Now you take a blood pressure and then wait for another 1 or 2 minutes and repeat the blood pressure. We usually prefer that you take multiple measurements throughout the week, different times. Now, if you were diagnosed with high blood pressure, sorry, I went the wrong way. I apologize. There are multiple numbers that your healthcare professional usually are very aware of. Usually, we would like your blood pressure in the green, where the systolic blood pressure is 120 and less, and the diastolic blood pressure is less than 80. There is a stage where we call it the yellow stage, where the blood pressure needs to be watched. It might not need any treatment, but it just needs more frequent observation, where your blood pressure is between 120 up to 129. And then there is the high blood pressure stage 1, where the blood pressure is 130 to 140, with a diastolic blood pressure between 80 to 89. This stage still may not need any treatment, and all what it needs is a lifestyle modification. Now, then we move to stage two, hypertension, where your blood pressure is clearly higher than 140, and your diastolic blood pressure is higher than 90. There are some serious blood pressure emergency that require urgent attention and a visit to the emergency department if the blood pressure recorded to be higher than 180 over 120. If you are looking for a list of symptoms and signs for high blood pressure, you probably will not find them. Unfortunately, we used to call this disease the silent killer because you could run for years with high blood pressure without having any symptoms. Some people, and those are the minority, might experience certain symptoms like early morning headaches or nosebleeds or sensation of shortness of breath or feeling restless because of the high blood pressure. But the majority of patients has no symptoms for their high blood pressure. This is a local study that has been done in Saudi where we looked at people above the age of 40 and we used the same number that we use for defining blood pressure. And to our surprise, if we look at the total number, nearly 55% of the patient has undiagnosed blood pressure. And of those who do have blood pressure problem, only 20% of them, unfortunately, they have uncontrolled blood pressure, with the minority of people have controlled blood pressure. What can I do to prevent the damage to that caused by the blood pressure? Remember, high blood pressure can damage organs over years. The brain can lead to stroke, and it also can lead to early dementia. The heart, it can lead to heart attacks, and also it can lead to a weak heart muscle. It's also one of the reasons why patient can have chronic kidney disease. One of the most important facts to prevent the effect of high blood pressure is actually to be compliant with the medication once it is prescribed. Exercise. Exercise has been shown in lots of research to reduce the blood pressure and have a favorable effect on high blood pressure. Between 150 to 180 minutes, 5 days a week will be a great exercise routine for managing a blood pressure. Minimizing alcohol, stopping smoking, eating a diet that's healthy and rich in fruits and vegetables, and reducing the amount of salts. Another important factor is actually managing stress. Managing stress is very important to control your blood pressure. I'll leave you with this slide to remember. When measuring your blood pressure, the size of the cuff, if you are using a whole machine, has to be appropriately sized for the size of your arm. It cannot be too small or too big, as it will lead to errors in the measurement. Physical activity has been shown to reduce the risk of having uncontrolled hypertension and hence the associated heart disease and brain disease. Always control your anxiety and stress level. Try to stop smoking. Reduce the amount of caffeine. Make sure you minimize the alcohol level. Thank you and have a nice, healthy World Heart Day. اوكي يا خالد. ايه كلمت عليه؟ لا لا، كلمت عبد المحسن وقال لي موست لايكلي هي ويل بي دن. بالعكس، بس اذا كان ممكن تنظم لنا فاميلي ميتنج مع ابنه شاكر عشان نتكلم معه. اذا كان بس تقدر تجيب لي ابنه شاكر هذا بكره نتكلم معه بتوين التابي كيسز. وغير كذا خلاص، يعني ديفنتلي كنت تنزل وتنهي العمل، ما عندك مشكله. I honestly I don't see a reason why not to. لانه يعني السيتي سكان is not going to make a major difference. He's an end stage renal disease. He's going to be in dialysis. انا تكلمت مع عبد الرزاق امير. It's very important also for a discussion مع العيله انه يكون عندنا السيتي. فانا يعني I honestly will advise to go ahead and do the CT scan. والله very unlikely. بالعكس، اذا كان كذا انت خايف ارسلوا السيتي سكان مع 100 سي سي ان اور اوف نورمال سيلين for a total of 1.5 liters. 150 100 an hour. انت حتسويها بكره؟ خلاص. طيب اذا كان كذا ابداع، انا اقول لك بالضبط متى تبدا. ابدا الساعه 4 الفجر 75 سي سي ان اور، خليها 75 سي سي ان اور قبل ما يوصلوا كذا. هنكملها بفور وافتر خلاص. كلم امير، كلم امير، بس definitely this guy is gonna go for a tag. يلا يعطيك العافيه.